So can you tell us what is social distancing, Gavin, and why is this important?
Social distancing includes ways to stop the spread of infectious diseases. It relies on physical distance. It means less contact between you and other people.
And how does social distancing look different in the hospital?
Well, we really have to consider what you need to do when you leave and come back home, when you're going to the hospital to work. So we want you to start by not mixing your outside and inside clothes. Leave your hospital clothes at the hospital, or if you need to bring your scrubs home to wash them, then change into clean clothes at the hospital and put your scrubs in a bag to bring home. When you get home, create a dedicated reentry zone. This is an area to change clothes and shoes and unpack packages. When you get home, or even when you go to work, take a shower or a bath after every outing. So that's really important when you get home, and even possible when you arrive at work. But also when you're at work in the hospital, remember social distancing is all about physical space, physical distances. So keep 3 paces or at least 6 feet between people. Still have meetings, but make sure you have that space between you.
So what can I do while I'm at home if I'm someone who is home telecommuting?
Well, we all know we need to wash our hands frequently with soap and water, but we need to wash our hands effectively and properly. Back, front, between the fingers, around the thumbs, between the nails. And that should take you about 20 to 30 seconds. But don't store your toothbrush and your hairbrush next to the toilet. Put them in separate rooms. Start practicing better personal hygiene. Clean and disinfect high-touch surfaces, such as tables, kitchen benches, doorknobs. And remember, you have to clean before you use the product, the disinfectant, and read the labels. The label on the disinfectant will tell you the wet contact time that's needed to inactivate or kill this virus. Increase ventilation in your home by opening windows or adjusting air conditioning. If you have to leave the house for an essential trip, visit shops sparingly, but more importantly, you could buy goods and services online, and consider whether any outings and travel, both for you yourself and your family, are sensible and necessary.
So what if I do need to leave the house to get food or medications?
If possible, get it delivered. But if you have to leave your house, minimize the number of trips. Or if you're in that category where you have an underlying medical condition, or you're really worried about coronavirus and you don't want to leave your house, see if a neighbor or someone else can do it for you. If you do leave your house, wear something on your hands, gloves, mittens. Now, for me personally, I'm less likely to touch my face if I have something on my hands. When you go into the supermarket or the pharmacy or any other shop, try to use the self-service checkout. When you come home, unpack bags outside or at your door in your designated re-entry zone. Wash and disinfect items before storage by, again, using soap and water. Remember, coronavirus is an envelope virus. It's the easiest of germs to kill or inactivate. And soap does damage the envelope, and when the envelope's damaged, it makes the virus unable to infect people.
What if I need to use public transportation in order to get to where I'm going?
A lot of us have to leave our home to go to work, and a lot of us need to take public transport to get to where we need to be, whether it be an essential trip or go to work. When you take public transport, avoid touching surfaces like poles and handles. Again, you can wear something on your hands like gloves. Remember to keep that physical distance, 3 paces or 6 feet. Often we can't judge the distance, what is 6 feet, so try understanding and knowing what is 3 paces. If you have to get in an elevator, practice facing away from the other people, from each other, so you are back to back, not face to face.
And what if I have someone at home who's ill that I'm caring for?
Well, care for the sick person in a single room if possible. Keep the number of carers to a minimum. Keep the door to the sick person's room closed. And if possible, open a window. Both the sick person and the people caring for them should cover their nose and mouth when they're in the same room. Now, we may not have the masks that everyone wears in hospitals, so you need to wear a makeshift mask, but try to physically cover up your nose and your mouth. That's better than doing nothing at all. Again, wash your hands, but also wash clothes and bedding that the sick person may have used separately. And if you suspect you or anyone in your house has coronavirus, please call a medical provider for advice, and they'll provide you with the next steps. Don't just leave your house. Now, if your situation is life-threatening, you need to call 911.